Director General, Dr. Tedros, Dr. Mike Ryan, Executive Director, Health Emergencies, Dr. Maria von Kerkhoff, Technical Lead on COVID-19, Dr. Mariangela Simao, Assistant Director General, Access to Medicines and Health Products, Dr. Sumya Swaminathan, Chief Scientist, Dr. Bruce Aylward, Special Advisor to Director General and Lead on ACT Accelerator, Dr. Kate O'Brien, Director, Immunization, Vaccines and Biologicals, Dr. Peter Ben-Mbarak, International Team Lead on the WHO-convened global study of the origin of SARS-CoV-2. And now, without further delay, I would like to hand over to Dr. Tedros for his opening remark and to introduce our guest. Over to you, Dr. Tedros.
Thank you, Fadila. Good morning, good afternoon, and good evening. Just over a year ago, WHO launched its first strategic preparedness and response plan for the COVID-19 pandemic. The SPRP outlined the comprehensive response needed and which many countries have followed successfully to suppress transmission, protect the vulnerable, and save lives. With an ask of $1.7 billion, the first SPRP saw an unprecedented response. With the support of member states and donors, we raised $1.58 billion, over 90% of which was allocated to countries and regions getting vital funding to those at the front line of the pandemic and supporting WHO's core scientific and technical work. It also enabled WHO and our partners to ship millions of tests and items of personal protective equipment and to support thousands of ICU beds around the world. We deployed 191 emergency medical teams, supported seroepidemiological studies in 58 countries, offered 150 online training events reaching 4.7 million participants, and much more. Today, we're proud to launch the Strategic Preparedness and Response Plan for 2021. The new plan builds on last year's SPRP with 6 objectives: suppress transmission, reduce exposure, counter misinformation and disinformation, protect the vulnerable, reduce death and illness, and accelerate equitable access to new tools, including vaccines, diagnostics, and therapeutics. The financial need to meet these objectives is $1.96 billion, including $1.2 billion for the WHO component of the ACT Accelerator. And $643 million will go toward supporting people in need of humanitarian assistance in fragile, conflict, and vulnerable settings. The SPRP also recognized the need to fully integrate the COVID-19 response into planning for health and development programs. Fully funding the SPRP is not just an investment in responding to COVID-19. It is an investment in the global recovery and in building the architecture to prepare for, prevent, and mitigate future health emergencies. At the beginning of the year, I issued a call to action to ensure that vaccination of health workers was underway in all countries within the first 100 days of the year. Tomorrow marks the halfway point, and we have made progress, but we are not there yet. With the emergency use listing of 2 versions of the AstraZeneca vaccine this week, COVAX is ready to roll out vaccines and is waiting for several manufacturers to make good on their commitments. The world is moving closer to delivering the promise of vaccine equity. Vaccine equity will be on the agenda at both the G7 leaders meeting and the Munich Security Conference tomorrow. Tomorrow, WHO will also launch a new declaration focused on vaccine equity, and I have been encouraged by the support we have received from hundreds of organizations and thousands of people. Health worker groups, international agencies, religious groups, youth movements, sporting bodies and athletes have all signed the declaration. The declaration calls for action from several groups. It calls for political leaders to increase contributions to the COVAX facility and to share doses with COVAX in parallel with their own national vaccine rollout. It calls for vaccine manufacturers to share know-how with the COVID-19 technology access pool to scale up vaccine manufacturing and dramatically increase the global supply of vaccines. It calls for regulatory bodies to accelerate approval processes in a safe and effective way. It calls for ministries of health to work with WHO and others to invest in and prepare their primary healthcare systems for distribution of COVID-19 vaccines to health workers and to develop data systems on vaccine supply, distribution, and uptake. And it calls for all governments to ensure that COVID-19 vaccines are distributed free at the point of care, without risk of financial hardship, starting with health workers. Vaccine equity is especially important for fragile and vulnerable groups, and for small island states like those in the Pacific and Caribbean, with small populations who can miss out on vaccines because they have less bargaining power than bigger countries. Everywhere means everywhere. Nowhere should be left behind. Today, we are privileged to be joined by the Honorable Dr. Kit Rowley, the Prime Minister of the Republic of Trinidad and Tobago. Prime Minister, thank you for your leadership and thank you for joining us today. You have the floor.
Dr. Tedros, Director General of the World Health Organization, other members of the WHO team, journalists, a very good morning to all viewers and listeners who are tuned into this program on vaccine equity. Today, as Prime Minister of Trinidad and Tobago, I represent our Twin Island Caribbean nation, as well as the region of CARICOM, being chairman of that regional body at this time. I'm really honored to be invited and afforded the opportunity to participate in this public conversation on our world's ongoing challenge of responding to a virus which for more than a year has been ravaging our populations, destroying our economies, and killing us indiscriminately across the world. At the onset, I want to thank you, Dr. Tedros, and the broad spectrum of staff at the WHO for the leadership, guidance, care, comfort, and hope that you have consistently provided all the way from the beginning of a perilous journey through this very dark night. Your pivotal role underscores the obvious need for this global organization's existence and sustenance. And we trust that you will always be there to hold a candle to us all, wherever and whenever we on this planet are confronted by microbes or any other form of human health challenges. After a period of disbelief, it is with great satisfaction that we welcome the news of the intention of the United States of America to return to this place of science and world leadership in this vital and fundamental business of human care. Dr. Tedros, colleagues, fellow citizens of the many countries, I trust that it is clear to us all by now that large or small, rich or poor, powerful or feeble, none of us will be free from the devastation and propagation of this virus until all of us are free of its grasp and have overcome the direct and indirect destructive dominance of this microbe. 1 year ago, when the full nature of the pandemic was realized, we were very unsure of its reign. But among our fervent hopes, even then, was that our collective scientific know-how would lead us to a vaccine in the shortest possible time, and we prayed for its efficacy. Today, thankfully, we are at that place where we now have tested and proven vaccines. A brightening light is shining on our way towards a more successful response to the still marauding virus. Even as we breathe a sigh of collective relief, we acknowledge the logistical difficulties associated with instantly satisfying the needs of all of people. But we do have models of sharing and caring, which would allow all of us to be beneficiaries of fair and equitable access, as WHO go on to hopefully certifying more and more of the life-saving vaccines. Our history as people is littered with instances of destructive behavior, disrespectful dominance, imbalances, and other forms of man's inhumanity to man. But on this rare occasion, when we are all yoked to an invisible destroyer, it is my hope and plea that when the journal of this experience is written, it would deviate from what is mostly the norm and record that on this occasion, the rich took care of the poor, and the small and impecunious were not trampled with disdain by those who could have done so simply because they had the wherewithal to do it. Today, on behalf of all small island states, of which the Caribbean's CARICOM group is probably the best example of those with fragile economies, small populations with limited technical and financial resources, as well as other vulnerabilities, who are disproportionately being ravaged and threatened by COVID-19 and all its variants. We are to remind that we need the systems of fairness, caring, and sharing to work according to a plan so that we can all come out of this dreadful experience guided by principles of equity and compassion. As there is the understandable rush to receive the vaccines and inoculation of our various populations, we are more than a little bit concerned that there is or is to be hoarding and price gouging, as well as undue preference in some quarters. This being so, we at CARICOM have recently called upon WHO to immediately convene an international convention of the world's people's representatives to commiserate, explain, assist, and commit to a fair sharing of the available vaccine resources for the benefit of all humankind and not just the privileged, well-heeled few. Today, we continue to make that call. We are also wary of the many charlatans who are increasingly emerging as they stalk the vulnerable with offers of opportunities that seem too good to be true, only because they really are, but are protected by the many disguises. On this day, the work of WHO is far from over. Now more than ever, you are required to protect us from the many offshoots of the viral era and encourage the science, not only to further understanding the biology, physiology, and management of the virus, but the defeat of its power through equitable distribution of its nemesis, the vaccine. Mr. Director General, small states such as ours have made and continue to make high and huge sacrifices in an endeavor to protect our populations from the worst ravages of the virus. We anxiously anticipate the promised relief and general benefits that a successful early vaccination program can bring to each of us. All we ask as members of the family of nations is that we not be forgotten, ignored, or worse, taken advantage of in this business of life and death. Director General, the CARICOM once again acknowledges your good work and dedication and looks forward to receiving you in the healthy Caribbean in the very near future. We hold out great hope as we thank all health caregivers at every station and location. And to you all we say, thank you.
Thank you. Thank you so much, Prime Minister. It's such a great honor to have you. And I fully agree. We have models of sharing. We have models of caring. And this invisible destroyer, as you have said, a common enemy, cannot be defeated without solidarity. Thank you so much indeed. And I would also like to recognize that Trinidad and Tobago, your country, has done very well in this pandemic. And this is because of your leadership. Even without vaccines, using simple public health solutions, we can see from your own experience that this virus can be controlled. So thank you so much for your leadership, Your Excellency, and I welcome your solidarity, and I'm pleased that your first health worker was vaccinated today. The record-breaking pace of COVID-19 vaccine development shows that where there is a will, there is a way. If people everywhere demand vaccine equity, it can be done. Let's join His Excellency the Prime Minister and show that the models of sharing and caring can work. Thank you, and Fadila, back to you.
Thank you, Dr. Tedros, and thank you, Prime Minister. I would like just to add that we have been joined in this press conference by Dr. Michel Yao. Michel Yao is Director Strategic Health Operation at WHO. Now I would like to open the floor to questions from members of the media. I remind you that you need to raise your hand using the raise your hand icon in order to get in the queue. And please don't forget to unmute yourself. I would like to invite first the first journalist, Gunilla von Hall, Svenska Dagbladet, Sweden journalist, to ask the first question. Gunilla, you have the floor.
Hear me?
Yes, go ahead,
Yes.
Gunilla.
I'm sorry for that. Thanks for taking my question. It is about the South African variant, as it's spreading more and more, and in about 16 European countries now too. How worried should we be about this variant? What do you know about how much more contagious it is than the original virus? Does it create more serious disease? And specifically, does today's vaccines that we have, do they give enough protection against the South African variant? How pressing is it to create second-generation vaccines that includes this variant? Thanks.
Thank you, Gunilla. Dr. Van Kerkhove will take the first part of your question.
Thanks. I will begin, and maybe, Kate, you want to come in on specifically around the vaccine. So there are a number of virus variants that WHO is tracking with global partners around the world, one of which has been identified in South Africa. I would like to urge us not to call these the South African variant or the UK variant. Really, we need to try to remove any of the stigmatization against any of the countries that are working hard to recognize any mutations and changes in the virus. As you know, the virus evolves, it mutates, it changes. This is evolution, and this is natural. The variant that was identified in South Africa, the 501YV2 or the B1351, is being studied right now, looking at transmission, looking at severity, and looking at any impacts on neutralization, diagnostics, therapeutics, and vaccines. All mutations and variants of interest and variants of concern will undergo the same type of research so that we better understand what all of these changes mean. And WHO, with partners, is setting up a global risk monitoring framework to make sure that we are tracking the changes in the virus and that we are studying these with a robust process that is done quickly and in a coordinated manner around the world. The variant that was identified in South Africa through a great work across the country and the sequencing capacities that they have increased over the last year. There is increased transmissibility that has been identified with this variant, similar to what we've seen with the variant identified from the United Kingdom, suggesting that it's more transmissible. It does have the same mutations that we've seen in some other variants, which increases its ability to bind to cells, to infect cells. but it's similar along the same order of magnitude of what we've seen from the variant identified in the UK. I should say that even with increased transmissibility, South Africa has shown that with the introduction of the public health and social measures that they have been using since the start, that this virus variant can be controlled. And we have seen reduced incidence over time. We do not see any changes in disease presentation or severity, or change in in-hospital mortality with this variant as opposed to the other viruses, the SARS-CoV-2 viruses that have been circulating. There is a suggestion of some decreased neutralization capacities for the variant, the B1351, and there have been some studies, as you've heard, that have been looking at differences in vaccines and vaccine efficacy. I should say that we don't see any changes in diagnostics, in our ability to actually detect this virus variant, as well as other virus variants identified in Brazil, identified in the United Kingdom, and other mutations that have been picked up around the world. But I do just want to emphasize that it is really critical that we increase our surveillance for mutations and changes in the virus through good epidemiologic surveillance, good case detection with molecular testing and antigen-based testing, as well as increasing our sequencing capacity around the world. We are looking to leverage and build from existing systems, sequencing capacity systems around the world, with our SARS-CoV-2 lab network, our global influenza surveillance and response system, our GISRIS system around the world, as well as leveraging our HIV labs, our polio labs, et cetera. And in areas where we don't have that capacities in country, we're looking to see where we can support sequencing capacities through private labs or academic labs, and through collaborations, regional collaborations, which are growing. We have good regional labs in Africa, in the Americas, in the EMRO region, across the Pacific. But again, it's building, this is part of building back better. It's making sure that we have systems in place, sustainable systems in place going forward. Kate?
Yeah. So just to address the question of the vaccines and the variants, I think the first thing to say is that this is a very dynamic, a very evolving area of information. As you know, throughout this pandemic, we have a set of information that comes in real time, and we're following it really carefully, and this is, of course, one of the areas that we're looking at extremely carefully. When it comes to the variants of concern and the vaccines, there are really two kinds of pieces of information that are relevant. The first piece of information that is most relevant is actual measurements of whether or not vaccines, in the face of wide circulation of variants, are preventing disease, as they have been demonstrated to do in the clinical trials when variants were not present. Now, some of the clinical trials were conducted in countries, in settings, in time periods when there were variants that were very common in the community. And so from those clinical trials, we do have some evidence about the performance of vaccines against variants. In general, what we're seeing across a number of the vaccines, so that includes the Johnson & Johnson vaccine, the Novavax vaccine, and the AstraZeneca vaccine, in the B1351, the variant first identified in South Africa, is that there is a lower efficacy than was demonstrated in other parts of the world where that variant wasn't circulating. As you can probably appreciate, though, the certainty about that is relatively low, because the numbers of cases that were identified in one setting, the South Africa setting, was lower than in the aggregate data from around the world. And in particular, for the AstraZeneca vaccine, the clinical trial that was conducted during the period of circulation of that variant was a small clinical trial that was not designed to address this question. And furthermore, that clinical trial did not include anybody who, there were no events of severe disease that occurred in the people who were enrolled in the clinical trial. So we don't have information about whether or not there was efficacy against severe disease, only information that was not conclusive about the reduction in efficacy against mild and moderate disease. And the reason I point that out is that for, generally speaking, for respiratory viral vaccines and the evidence in some of the vaccines for COVID, we do see that there is higher efficacy against severe disease than there is against mild and moderate disease. So this is an important caveat to the evidence that's out there. The second piece of evidence that is available and continuing to grow in terms of the number of studies that have been done and the number of vaccines for which these kinds of studies have been done are the lab-based studies. And those are studies where a laboratory will grow the virus and then test the sera from people who have been immunized, so the sera that was collected after immunization, to see whether or not that serum can actually neutralize the virus, can stop it from replicating. And those studies, again, in general, have shown that for the variants of concern, the B1351 and the B117, the variant first identified in the UK, that there have been reductions in the ability of those post-vaccination sera, again, across a variety of the vaccines, a reduction in the ability of those sera to neutralize the virus or stop the virus from replicating. What's important about that is that, in fact, we don't have full clarity that neutralization of the virus is the component of the immune system that alone is the thing that is stopping people from getting disease. So we're in still these early days of interpreting the evidence. And again, the most important thing is to get more information about what's actually happening with respect to disease. In general, we see that the vaccines retain efficacy against disease, albeit at a lower level than in settings without the variants that are highly prevalent. So our big message is that we should get on with vaccination as quickly as possible, and at the same time do everything possible to reduce transmission, because the more these viruses transmit, the more likely they are to have additional mutations occur and more likely to have issues that could emerge that relate to reduced impact of the vaccines. So as we're quickly rolling out these vaccines, it's ever more reason for transmission to be reduced through every means that we have available, including masking, hand washing, physical distancing, ventilation, avoiding crowded, engaging with people outside your household. Thank you.
Thank you, Dr. O'Brien. I would like now to call on Jamil Chad, Brazilian journalist, UOL, to ask the next question. Jamil, you have the floor.
Thank you, Fadela. Good morning or good afternoon. This is probably a question to Dr. Ryan. We've seen in the last reports, the weekly reports by WHO, a fall in the number of new cases around the world and the fall as well on deaths. However, we do see a persistent high number in Brazil, both of new infections and deaths. I would like you to comment a bit on this insistence on the numbers being high, and whether, for example, events such as Carnival, although it did not happen in a public way, we've seen many parties and beaches very full. I mean, how much of that do contribute? Thank you so much. All the best.
Dr. Ryan?
Yeah, it's difficult to make a specific comment, but it's certainly true that countries that have had very intense outbreaks in a country as large as Brazil, where the disease have penetrated so deeply in the community, the virus still has and had a lot of energy. You're also obviously dealing with an urban-rural situation, urban settings. Many people still live in areas that are overcrowded, multi-generational, multi-family homes. It is very difficult to break the chains of transmission in a complex society. So some countries are coming down the hill more quickly than others. But I think the important trend is that almost all countries, and certainly all regions, we're seeing the downward trend. And that needs to continue and needs to continue to be supported. And yes, we are coming up increasingly now again as spring arrives, people will want, in the Northern Hemisphere, people will want to celebrate more, obviously, the celebration in Central and South America, all over the world, the celebration of on Tuesday of Mardi Gras and other things, very important celebrations, very important in terms of people's hope and for the world. But we will have other things like Easter. In my own country, we will have St. Patrick's Day. We will begin to want to celebrate these things again, and I would just caution that we have to be very careful. We're certainly not out of the woods yet. And I think as we move into the springtime, we need to drive towards higher levels of vaccination, getting equitable distribution of that vaccine, getting rid of the deaths and the hospitalizations and the suffering, but continuing to drive the case numbers down. Kate has said it, I think Maria said it, the best way for us to avoid the emergence of variants is to drive and suppress transmission now, and to use the vaccines that we have. But in the case of Brazil, the patterns in Brazil differ by state, so it would be difficult to go into a complex discussion. Mariangela is sitting beside me. She may have more detail. I'm always nervous because I have a very accomplished Brazilian scientist sitting beside me when I speak about Brazil. So I will leave my comments at that. And again, it is really important. Brazil is a very, very large country in a very important region of this world. And what Brazil does matters. Brazil has always led the Americas in the science and in combating infectious diseases. There's a very proud history in that. So therefore, what happens in Brazil does matter. And as Brazil gets better control over this virus, it will be a beacon of hope for the rest of the Americas and for the rest of the world.
Just complimenting Jamil, boa tarde. What Mike was saying now is also, it's important that we even if we see the total numbers globally coming down, and last week, today is, no, this week, we have already mentioned during the last presser that this is not the time to let the guard down, because we have seen the numbers coming down in some countries before, just to see a recurrence of the numbers going up again. So it's still too early for us to say anything. As Mike has mentioned, Brazil is like a continent, right? So you have all these different, the epidemic is moving differently in the different states, right? And it moves ups and downs. So don't let your guard down yet. It's a moving target. We need to be sure that we keep watching, we keep doing the right things as WHO's recommend.
Very briefly, to just support that, because I think so many countries are in a situation where case numbers are coming down. And 5 weeks in a row, we've seen incidents reduced, and that is wonderful. It means that what we are doing, what all of us are collectively doing together, is driving down transmission. As Mariangela has just said, and as Mike has said, and you've heard all of us say many times, now is not the time to let your guard down. We can continue to drive transmission down. Recall where you were a year ago, 8 months ago, 10 months ago, where transmission was going down in many countries around the world. We cannot let ourselves get in a situation where the virus can resurge again. Remember where we were, remember what we need to continue to do to drive it down, get cases down into single digits. We do see the situation in Brazil. I mean, I'm looking at the weekly numbers, and there is a decline that we're seeing here. We just need to stay the course, hold on to what is working consistently, deliberately, as we roll out vaccines and make sure that vaccines and vaccinations start in all countries. And we all call upon vaccine equity around the world to those who are most in need at this time.
Thank you. Now I would like to call on Joshua Collins from the New Humanitarian. I think he has a question to the Prime Minister Rowley. Joshua, are you online?
Hello, thank you for taking my question. Yes, I have a question for the Prime Minister. I recently read your comments that the vaccine will be offered to any human being in Trinidad and Tobago, regardless of their status. And I was curious if you could describe the plans of the government for addressing the sizable informal migrant community, particularly among Venezuelans.
Thank you. Prime Minister, you have the floor.
Thank you very much. We in Trinidad and Tobago, we have a fairly significant number of migrants within our border, and we acknowledge the nature of the problem, and we would only be successful in protecting our local population if everybody within our border gets the same kind of treatment, because to have a migrant population that is not covered by our concerns and our response is to maintain a population within which the virus would be a permanent feature and from which it can be transmitted continuously to everybody else. So our effort of contact tracing would identify persons, whether they're migrants or not, and if they are persons of interest with respect to our effort, we have to treat them so that they do not suffer from the infection, and also would not pose a threat to the rest of those who are not persons of interest at the time. So we do have to look at everybody, and we are hoping to do that. Fortunately, we have had relatively low levels of spread, and we have not had an overbearing number within that particular population. So we are not separating and discriminating against persons, because that would make a nonsense of our effort.
Thank you, Prime Minister. I would like now to invite Helen Branswell from STAT to ask the next question. Helen.
Thank you very much, Fadela. I was hoping we could get an update, please, excuse me, on the Ebola situations in DRC and in West Africa. Have there been cases found outside of Guinea in West Africa, please?
Helen, we have Sosifal and Michel Yao online. To date, we have not found cases outside Guinea in West Africa, and again, all countries in the area are on super alert at this stage. Our regional director for Africa, Dr. Chidi Mwete, has had discussions with the ministers of health from the West African Health Organization, and a lot of work is underway to create an integrated strategic preparedness and response plan for the sub-region that would include all countries that are potentially threatened, and specifically help drive a strong coordinated response in Guinea under the leadership of the government of Guinea, with all partners supporting. But I will hand over to Michel or Sose. They may be able to, and just to confirm, Helen, I know you had asked this in text, we can confirm that this is Ebola Zaire, with further sequencing to be carried out at Institut Pasteur over the coming days. So Michel or Sose, if you can give us the latest in terms of numbers and operations.
Thank you, Mike. This is Sose. Thank you, Ellen, for the important questions. We don't have additional cases in West Africa, including Guinea and neighboring countries, but the most important thing is we consider the risk as very high in all countries. And we have started already working with all neighboring countries for preparedness and readiness, including using our contingency fund for emergencies. We just finished a call with all our teams from the regional office, the 7 countries, and we agreed that this is a grade 2 emergency, meaning the highest level of emergency in WHO. So we are going to continue working with this country to make sure that any new case can be detected both in Guinea and neighboring countries, and a rapid response be implemented to contain it. Thank you.
Thank you, Dr. Sose. Michel, do you want to add something?
Yeah, thank you very much. I will just have to add that at least for this outbreak, we have some assets. We work in DRC with different new tools, and we have effective vaccine therapeutics that at least from the preliminary lab analysis show that it could be the same strain So these tools could be effective. As we are speaking, there is vaccines on the way to Guinea, so vaccination will start soon with mainly health workers as well as high-risk contact. In DRC also, vaccination has started. Taking also a lesson learned from COVID, we will remain proactive, mobilizing different aspects. We still have some work to be done, for example, in vaccination, to ensure that at least the immunity remains strong while those people vaccinated are exposed again to the virus. So some work in research still need to be done. So all these different components WHO will be supporting. We have already deployed staff on the ground around the epicenters, supporting government and also mobilizing different partners in respective areas, including community mobilization with UNICEF and also NGO partners working in these areas. Thank you very much.
Can I just come back and then to recognize the very strong response also from partners in the Global Outbreak Alert and Response Network, our colleagues in MSF, CDC, ALIMA, UNICEF, Red Cross. Classically in many of these responses, the government is supported in safe and dignified burials very often by the Red Cross movement, in IPC and community engagement by Red Cross, by UNICEF, by other INGOs. MSF, obviously hugely skilled across all aspects of the response. We're all agreed that what we have done in Congo in supporting the government-led response and having a single coordinated plan with all partners playing their part to support those responses, both in terms of inside Guinea, but then the preparedness and readiness. I think Director General has spoken many times that the Ebola response in Congo was not just a response in Congo. It was a response, a preparedness and readiness response in 13 other countries surrounding Congo, especially 9 high-risk countries. And we saw the disease imported twice into Uganda and did not create a single chain of transmission, because the disease was managed very, very well by the Ugandan government and the Ugandan authorities, who had prepared exceptionally well for the imminent arrival of the virus. So this is a time when we have an opportunity to prepare and be ready. The DG has spoken many times about windows of opportunity. Well, we have that window of opportunity in West Africa. We have an early alert. It is sad to think that it has to be the death again in a health worker that triggers the system to respond. It's a sad event for that family and the extended family around that person. But we do have the opportunity to do better this time. And we also, as Michelle said, have the vaccines, and we have the monoclonal and polyclonal antibodies. It is very, very important that we have a coherent vaccination strategy across the sub-region. The classic vaccination strategy that has proven effective in Congo and previously in the clinical trials in Guinea was a ring vaccination strategy based on the exhaustive identification of cases, and then the identification of contacts and contacts of contacts, in a sense, social rings, the rings of transmission around an individual, and that has proved to be highly effective in stopping the outbreaks before. And that vaccine we use for that is produced by Merck, and we have stockpiles of that en route, as Michelle and Sose have said. We also have the opportunity to potentially use the J&J vaccine, which is a 2-dose vaccine, likely to give longer-term protection and probably better adapted for vaccinating health workers far away from the epicenter and giving them a protection that may last for even longer. So we would look and are working with the governments in the area to come up with a coherent vaccination strategy that could utilize both products under an expanded access protocol. But those activities will require enhanced surveillance and enhanced data gathering, so we're working with the governments to ensure that we can implement all of that. And again, remember that these governments are currently responding to COVID-19 outbreaks in their own countries while having to either respond to Ebola or prepare for the potential arrival of Ebola. So we would ask our donors to look very, very carefully at providing extra support to those countries, to the NGOs and to the UN agencies supporting those countries in the coming weeks. Your investment will pay off. We saw that in Uganda over the last 2 years. Thank you.
Thank you. I would like now to invite a Japanese journalist from Asahi Shimbun, Kayoko Jeji, to ask the next question. Kayoko, are you with us?
Yes, I'm here. Can you hear me?
Very well. Go ahead, please.
Okay. Thank you for taking my question. So I would like to ask about the frozen food transmission. In the past press conference, Dr. Ryan said there is no evidence that food or food chain is participating in the transmission, and we should not fear food or food packaging. And I was a bit confused when China mission team mentioned about the cold chain transmission last week. Could you please clarify WHO's view on that? Thank you.
Thank you. I would like to invite Dr. Peter Benenberg to take this question.
Thank you, and thank you for your question. Yes, the frozen food issue is a little bit complicated because here we are talking about two very different situations. The first one is the possibility of reintroduction of the virus through the frozen food chain and through imported product back into China, where the virus has been more or less eliminated. So that's a situation for 2020, 2021, where the virus is widely circulated in the world and where we know that there are multiple outbreaks in food factories in countries where the virus is circulating. So that's one line of interest, particularly for China and other countries in the similar situation. It's a very, very rare event. Even China, through their extensive search for positive contaminated products through the food chain supply, have found only very few positive cases of contaminated products. Now, for 2019, where we are focusing on the origin of the virus, this is a very different situation. At that time, the virus was not widely circulating in the world. There were no large outbreaks in food factories around the world, and therefore the hypothesis or the idea of importing the virus to China through that route is not something that we're looking at. There, we are focusing on the Huanan market in Wuhan in December 2019, where a lot of frozen products were traded in that market. And there we are focusing on the trade, local trade of frozen farmed wild animals being farmed and produced in particular in southern China. So this is a very different possible line of introduction of the virus into the market environment in Huanan. And that's a very different focus compared to the discussion about international trade of frozen product. Thank you.
Thank you, Dr. Benenberg. I would like now to invite a journalist from DEVEX, Vince Chadwick, to ask the next question. Vince?
Hello, thank you. My question is for Dr. Tedros. I'd like to get your response to comments from Emmanuel Macron in the Financial Times this afternoon, who's calling for Europe and the United States to immediately allocate 5% of their COVID vaccines to Africa. He says he's discussed it with Angela Merkel. I'm wondering if he's discussed it with you, how it will work if your understanding is that this will be through COVAX, and if not, if it doesn't undermine COVAX, the fact that Europe is now starting to be more concerned about geopolitical competition. And relatedly, I wanted to ask about the EU sharing mechanism, which was discussed in Brussels a few weeks ago. I understand some European countries are interested in choosing which countries their doses go to, and that there's currently some discussions going on about that. I wanted to understand what your messaging is around that. Thank you.
Thank you. Vince? I would like to ask Dr. Edward to answer this question.
Thank you very much for the question, and a really important one. There's been multiple approaches taken to try and ensure we find solutions to the sharing of scarce resources, and especially vaccines, as rapidly as possible and throughout the crisis. And you'll remember, this is not novel to vaccines. At the outset of the crisis, we had real challenges around equitable allocation of PPE, of PCR, of oxygen, of ventilators. This has been a recurring problem, and that's the reason so much effort went into the establishment of the COVAX facility, and then also the allocation mechanism that would underpin it to ensure we got equitable allocation of vaccines as well. As we started to roll out, even in December, many countries approached us, and with thanks to the Director General who advocated for this, with an interest in sharing vaccines through the COVAX facility. So by mid-December, we had established a dose-sharing set of principles and a process for countries to share doses through the COVAX facility, especially for AMC countries or the low, middle-income countries that are part of COVAX. That was set up at that time. There was a lot of interest from many member states of the European Union, from Canada, from other countries that were interested to look at if they could dose share. So that mechanism was put in place back then. Those conversations have continued. Unfortunately, we've not seen yet the translation of those that interest, those commitments to vaccination to COVAX. Now, the reasons for that have been myriad. Some of it has been related to the outbreaks in countries themselves, the interruptions in vaccine supply to some of the countries interested, the mechanics of doing it. So there's been many challenges. But I think what was been really encouraging was President Macron's message today, and last week the Director General actually had the opportunity to discuss vaccines, the scarcity of vaccines, how to optimize their distribution with President Macron on 2 occasions to ensure that increasingly the global community could be aligned on this and find solutions. In terms of the EU's dose-sharing mechanism, we've also been in discussion with the commissioners at the EC about this. The Director General has, and we have, and again, are working through the process of trying to ensure that products that can be shared through the European Commission or through from EU member states or others can be shared as equitably as possible. Now, for equitable allocation, the best mechanism, the only global mechanism set up to do that is the COVAX facility. Now, there are some countries that other countries may have special arrangements with in terms of regulatory arrangements and financing arrangements and others, and may seek to do arrangements outside that. But even now, we are encouraging that in the interests of equity, the most equitable distribution possible, those doses go through the COVAX facility, because that way we can coordinate across a massive number of countries and ensure everyone is getting served, and that we get close to, if not achieve, the goal the Director General has set out, that all countries in the world are vaccinating their healthcare workers within 100 days of the start of this year, and ideally by World Health Day on the 7th of April. That's our goal. So this could be one part of the solution, and having leaders like President Macron stand up and make that challenge to the world is a fantastic development.
Yeah, thank you. Thank you so much. Just would like to add a bit. As you may know, from the start, President Macron had supported the ACT Accelerator. And when ACT Accelerator started, it had 2 objectives. One is accelerated development of products, including vaccines, and the second objective was fair distribution. So what he's calling for is in line with the objectives of the ACT Accelerator. And as Bruce said, we had a call with President Macron last week, and he stressed the importance of sharing, which WHO and other partners have been advocating for. And, one of the areas we have been focusing was actually donation. And we have asked many high-income countries to donate. And as Prime Minister Rowley said, sharing and caring is important, but that is actually in the interest of all countries. Countries who are sharing will benefit, and countries who are receiving will benefit, because we can drive out this virus sooner, and also that would help us in faster economic recovery. So we support his call. And not only for the donation, the immediate needs, but we discussed also about, the long-term distribution of vaccines, especially in terms of increased coverage. And one of the bottlenecks is production capacity. And we have discussed with President Macron the bottlenecks or the barriers to increased production. And we have agreed that we identify the solutions to the barriers and address them and increase production, so there will be more production that can make sharing easier. So the President is also working on addressing the long-term challenge we are anticipating, especially, which is going to be in some months from now. As you know, countries in Europe are now targeting to vaccinate 70% of their population by summer. And the target so far was 27% global, if we can cover that. So if Europe is targeting this, and the rest would also target increased or higher coverage. And for that to happen, we have to increase production, and we have to address all the barriers in order to increase production, and there is enough to share. Then on the second one, choosing countries, as long as the support goes through COVAX, it's actually welcome. If some countries prefer to give their donations to certain countries because they are their neighbors or because they have some relationship, what we can do is, if this comes through the COVAX, the earmarked donation can go to those countries, then the COVAX stock could go to other countries. So we can strike a balance. But one thing we have been asking from the start was the donations should go through the COVAX facility, so we know what's going where, and we can do a balancing act. We can balance it. One thing which doesn't help is when countries on their own go and provide directly to other countries, because the balancing will be, the balancing act will be a bit difficult when it's not going through the COVAX facility that can help in balancing the distribution or sharing. Thank you.
Maybe we have a little bit of time to take last question from Catherine Fiancon-Bokonga, France 24. Catherine, you have the floor.
Thank you, Fadela. Good afternoon to all of you. My question is related to Ebola. And excuse me, what Michael said before, I'd like to know a bit more about the research and development on vaccines on the other Ebola types, because if I know well, I mean, there are 6 types. The one that we have now is the Zaire Ebola virus, and I'd like to know what is the research doing now about other vaccines against the other types, and also why don't you organize a prevention vaccination campaign to the regions that are usually the most affected? Because we notice that it is always the same regions in DRC, particularly that are hit by the Ebola virus. Thank you. And if Dr. Sosé or Dr. Michel Yao could answer in French, that would be nice, so we can use it for French TV. Thank you.
Pas moi, non? Je vais laisser la parole avec Sosé. Sosé, vous avez la parole.
Merci beaucoup. Je pense que c'est une question très importante. Il faut préciser que nous avons un vaccin juste pour Ebola Zaïre. Pour les autres espèces, nous n'avons pas de vaccin dans le pipeline. Donc, il est important donc, de continuer à investir sur la recherche et le développement pour avoir des vaccins pour toutes les formes d'Ebola, mais aussi pour d'autres virus aussi dangereux que le virus de Marburg. Et donc, si on ne fait pas attention, aujourd'hui, nous parlons de milliards de doses pour COVID-19, mais si on ne fait pas attention, des maladies comme Ebola et les autres fièvres hémorragiques virales risquent d'être des maladies négligées et le danger est toujours là. En termes de stratégie de vaccination, il faut dire aussi que le vaccin ou les deux vaccins qui sont disponibles maintenant, le vaccin de Merck, le vaccin de Johnson & Johnson, n'ont été approuvés que récemment. Donc, les quantités disponibles restent encore limitées. Donc, la stratégie utilisée et qui est très efficace, qui a toujours marché, qui a été utilisée depuis l'élimination de la variole, est la stratégie de vaccination en ceinture, où les contacts des cas et les contacts de ces contacts à travers les réseaux sociaux sont vaccinés pour arrêter la transmission. Maintenant, dans le futur, il sera important de continuer à développer plus de vaccins pour avoir une approche préventive. Donc, dans des zones qui sont connues à risque, qui sont les réservoirs de virus pour Ebola, qu'on puisse avoir une stratégie préventive sur la base de vaccins efficaces et disponibles en quantité suffisante. Pour le moment, nous posons la priorité pour les travailleurs de santé et les contacts des contacts. Merci.
Je pourrais ajouter en disant que pour ces vaccins-là, il faut aussi se mobiliser, comme on l'a fait pour Covid. Il est important qu'on puisse augmenter les capacités de production et qu'on puisse produire suffisamment. Le deuxième point, c'est qu'au niveau de l'OMS, nous travaillons avec tous les partenaires sur un programme pour la lutte contre Ebola. Et ce programme, bien sûr, aura le volet vaccination avec le prépositionnement de vaccins qui est en cours avec des partenaires comme l'UNICEF. Mais ce programme devra, dans le futur aussi, permettre aux pays de mieux se préparer, d'avoir leur système de santé capable de répondre à cette épidémie, parce que le virus existera encore dans l'écosystème. Ce n'est qu'une question de temps pour l'avoir et avoir des résurgences dans ces pays-là. Donc, un programme à long terme est essentiel, comme nous l'avons pour certaines maladies comme la fièvre jaune. Merci.
And just to add, I think this is one of those moments, and those of you who know me will know, I don't say this very often, but I would like to recognize the contributions made by the companies Merck and J&J. The development, the research and the production of these vaccines was never made with profits in mind, and company Merck has actually constructed a brand new plant in Germany to produce this vaccine. And because of the production challenges for this type of vaccine, it's in relatively low volumes. So we would like to be able to expand that. But I have to recognize that both companies have been very diligent and really are working to try and produce these vaccines that everybody thinks they need every 4 or 5 years, but then in between, everyone loses the will to continue their production and their development. So there's been a fantastic public-private partnership between the R&D blueprint for epidemics. We do have the target product profiles for all those other vaccines we need for the other Ebola strains. The work continues. The ultimate endpoint for this, and I'm sure Kate would love this too, and Anna Marie and so many others, is a multivalent vaccine capable of protecting against multiple Ebola strains that we could certainly use in frontline health workers. We saw just now in this last outbreak in Guinea, the first major case that was detected is a healthcare worker. Again, the mine canaries of this system. But also occupational workers at risk, charcoal workers, people who work in the rainforests. There are many populations who are at risk who could be protected if we have enough vaccine that's safe and obviously at the appropriate cost. So this is really the holy grail of Ebola, is to have those countermeasures in place and not just be responding to outbreaks, but preventing their recurrence by the preemptive, proactive use of vaccination, which is always the best way to use vaccines. I'm sure Kate will agree.
Thank you, Dr. Ryan. Before I give the floor to Dr. Tedros, I would like to invite the Prime Minister, Prime Minister Rowley, if he has any final comments to make. You have the floor, sir.
Thank you very much once again. It really is comforting to know that we're making the kinds of progress that we've made reference to today. We do have some pitfalls to avoid, but I think the national populations are hopeful that in the not too distant future, and maybe by the middle of this year, we would have been receiving a certain level of vaccination that will allow us to believe that we are on a path where hopefully by the end of the year, many of our populations would be comfortable in the kinds of progress that we're making. I'm also very pleased to hear that across the world, our numbers are coming down and the curves are coming down, because we genuinely believe that if there is failure in one area of the world because of the nature of the virus and the problem that we are facing, that if there is this failure in any part of the system, that is a failure for all of the system. So this is a classic case of the chain being as strong as its weakest link, and we trust that none of our people will be that weak link. So thank you very much for looking out for small countries, looking out for small populations, those that are under-resourced, and also for focusing on the science, because that is what is going to give us the tool to treat with the challenges that we're facing.
Thank you so much, Your Excellency. I don't want to add anything to what you said. I fully concur, and thank you so much for your leadership. Thank you for joining us. And I know together we will make sure that vaccines roll out to all over the world. So thank you so much again for your leadership. And thanks to all colleagues and also journalists who joined today. And look forward to seeing you in our upcoming presser. I think that will be on Monday. Thank you so much.
Yeah, thank you, Dr. Tedros. Just reminding journalists that we will be sending the audio file of this press conference and Dr. Tedros' opening remarks as soon as we finish here. The full transcript will be posted on the WHO website tomorrow morning. I would like also to attract journalists' attention to a press release that was sent to you from WHO about the Ebola outbreaks in Guinea and DRC, as this is of interest to all of you. Thank you all and have a nice evening.